Slide blue button up with your thumb to rotate and straighten the T-bar. Insert into body directly through skin incision. Or you can insert through trocars 12 mm or bigger. Push top plunger down firmly using your thumb. Plunger should stop above orange limit stopper. Using included nerve block kit, inject into both holes on top of plunger. Do not pull up too much on M-close. This will allow anesthesia to flow. Bulging may not always be visible. Proceed to closure by flipping orange limit stopper down. Push plunger down firmly to second click. Push down until you feel it lock or click. Next, insert guide wand. Stop. Confirm plunger is fully down. White line on plunger should not be visible. Insert advancer tipped firmly inside either hole of plunger. Place your thumb on the back of wheel and advance forward. Continue advancing wheel until guide wire exits other hole and does not advance anymore. Hold guide wire and remove the advancer, exposing loop. Insert 2 to 3 inches of suture through loop. Do not tie the suture, just pull guide wire out. Do not hold sutures with your hand after guide wire is removed. Press top white button to retract needles. Advance M close inside the body to allow room for T-bar to rotate. Slide blue button up to rotate and straighten T-bar. Remove M close from body. Optional technique for thin abdominal wall. Advance M close until the white line and needle exit opening are visible inside the bite. Press the plunger down until the plunger white line meets the top of the orange stopper. You will see the needles partially exit M close without entering any tissue. While holding the plunger in place, pull upwards on the M close. Keep pulling until T-bar is flat against peritoneum. Now, continue pressing the plunger to the first click and proceed as normal.